So I'm going to just talk about a little bit about adjuvant trials quickly. So we really need more, clinical trials, more cures or treatments for metastatic disease. But is there a way that we can try to treat people even before they develop metastatic disease? Those high-risk people that Dr. D'Amato, has been able, and Dr. Singh have been able to identify with genetic testing. And so that's called an adjuvant clinical trial. Before people develop actual metastasis, we would treat the high-risk people with an adjuvant clinical trial. So there's a website called clinicaltrials.gov, and that lists the active clinical trials that are available. So when I search here for uveal melanoma, adjuvant, it pulls up these 7 trials. And so most of them are recruiting. And it pulls up stuff actually across different countries. So the ones that are highlighted in yellow are actually in the United States in different locations, and the ones in the blue are in Europe in a couple different locations. So this is just a helpful website if you're interested in learning more about potential clinical trials. So we basically have 4 adjuvant clinical trials in the US that are recruiting or not yet recruiting, but will be recruiting. And Dr. Singh has hosted a clinical trial here as an adjuvant trial in the past. So I think this is a really exciting area. I'm going to talk a little bit about the one that we're going to be doing at Ohio State University in conjunction with Memorial Sloan Kettering. And this is using a drug called Crizotinib for high-risk uveal melanoma patients after definitive therapy. And what that means is after they've been treated with brachytherapy or enucleation for the primary tumor. So basically, it's a single-arm, phase 2 multi-center trial. And the high-risk people are going to be identified by using that class 2 gene expression profiling test. So they'll have the high-risk genetics with class 2. And also it has to be a large tumor, so it has to have a base of more than 12 millimeters, because we want to select for the people who are really the highest risk category. And then they have to be within 3 months of having the brachytherapy or proton beam or enucleation treatment. And they have to have a negative metastatic workup. So, and then we're going to look at what's called relapse-free survival over a 3-year period. So basically, we are going to check and look at the rate of people who develop metastatic disease on the treatment over the next 3 years. And some other measures, including overall survival and disease-specific survival. So what is this drug, Crizotinib? Well, this is actually a specific, one of these targeted therapy drugs. So it's specific for the c-MET and ALK tyrosine kinase pathways. And it was actually around since 2010, and it's being used in some other cancers such as lung cancer right now. So actually it looks promising in terms of blocking cell growth, migration, invasion, and also new blood vessel formation that's important for cancers. So I talked about we're going to identify the high-risk people for this trial. And then why are we using this drug? Well, one of my colleagues, Dr. Abdel Rahman, had in 2010 published some work that this pathway, the MET oncogene pathway, is really important for uveal melanoma cells, for cell growth and proliferation. And it might be an interesting, helpful target for killing them with chemotherapy. And so what is MET? Well, MET is the receptor for hepatocyte growth factor. Okay, so hepatocyte growth factor, there's a lot of that. It's a growth factor for the liver. And as you can see in this picture on the right there, that brown staining is all the hepatocyte growth factor in the liver. And so this is a drug that's blocking that receptor, basically, for hepatocyte growth factor. And what Dr. Abdel Rahman showed is that in uveal melanoma cells and also primary tumors, there's a lot of that c-MET receptor and also hepatocyte growth factor being made. So it looks like it's a good target because it's in a lot of these tumors. And he did some work in the lab in cell lines showing here, I'll just show you here, showing here that it kills the melanoma cells while normal cells are really not affected so much by it. So that looks promising in terms of a drug for treatment. And then Memorial Sloan Kettering has recently published some data specifically with this Crizotinib c-MET inhibitor. And they found that in an animal model, it looked really promising. So they gave these mice human eye melanoma cells, And then a week later, they gave it the drug or control, and they looked at spread of the tumor. And even after the tumor's been there for a week, it really prevented spread statistically significantly. And here's the liver, and it looked much better in these animals that were treated. So it looks promising in this animal model, and it's already being used in people for different contexts. So that's where that drug came from. There's another MET inhibitor that's also being used currently for eye melanoma called Cabozantinib. There's a clinical trial now specifically looking at this MET inhibitor for metastatic uveal melanoma, and that trial is actually open at 145 centers across the country. So that looks promising in terms of the early data on that. So in terms of this adjuvant trial, I'll just quickly mention some details of it. There will be an active therapy phase, so people will take Crizotinib pills, 1 pill twice a day for almost a year. They're going to have scans about every 4 weeks and blood tests about every 4 weeks. And then there will be a follow-up phase, so that about every 3 months they're going to have scans after the drug is done. And if people do develop metastatic disease, we're going to see how they do with periodic imaging and follow-up. And there's also something called correlative studies. So what that means is we're going to look at the tumors that people get and also look at the blood and try to figure out why did certain people do really well with this drug and why did certain people maybe not do so well with this drug in preventing metastatic disease. So that's a lot of, just don't read the slide. That's basically what this slide is boiling down to. And then, in terms of the statistics on this, since everybody's getting the drug, we're relying on the statistics of the gene expression profile, really, and also the tumor size, really trying to pick the highest group of people. And based on some upcoming work by Bill Harbour, we know basically the typical relapse-free survival is 32 months for this group. So if we see that there's about 25% higher number of patients who have extended survival and no metastasis at this stage, then we'll say that Crizotinib looks like a promising drug to look at for the future. But I do want to just highlight, Dr. D'Amato brought up some really good points that adjuvant trials are a double-edged sword. We really don't want to do harm to anybody, and so we really have to look at the side effects, and that's something that will be under a lot of scrutiny with this trial. So Crizotinib, what's known about it is that it's pretty common to have some nausea and vomiting with Crizotinib, and concerning to all of us ophthalmologists is that there can be some visual changes. Typically the ones that I've heard about are wavy lines, sort of kind of like a migraine type of visual phenomenon, and you can also see floaters or maybe flashes of light. Some uncommon symptoms include fatigue, constipation. You can kind of read some of these other things. And then there can be rare serious side effects, including heart arrhythmias, liver problems, kidney problems, et cetera. So just like Dr. D'Amato said, we really have to watch closely for problems. And that's also why we want to look at quality of life and make sure, what's the quality of people's life with taking this type of adjuvant drug? Is it worth doing this? We really need to study that. So I'd just like to thank everybody who's involved in getting this clinical trial going, and I'd really like to thank everybody for your attention.